for the opportunity to present our research entitled Early Activation of Artificial Urinary Sphincter for Post-Prospective Stress Urinary Incontinence is Safe, a pilot study. There are no conflicts of interest or funding to declare for this study. Artificial urinary sphincter, or AUS activation, is usually deferred for 6 weeks following insertion. Traditionally, this time period is used to allow post-operative pain and swelling to settle before patient education is commenced. However, the 6-week delay is unsatisfactory for patients who would otherwise be able to benefit from using the device. We could not find any scientific reason to support the traditional 6-week activation period. This pilot study evaluates our prospective experience on the safety and acceptability of early activation within 30 days of surgery. A prospective database was established on consecutive patients undergoing AUS implantation with the AMS 800 Boston Scientific from June 2019 to February 2021 by a single reconstructive urologist. Activation was performed by the same surgeon. Early activation was defined as less than 30 days from the date of implantation, and patients were scheduled to be seen 2 weekly from the date of implantation and assessed for wound healing, pad use, quality of life, and adverse events. Activation was performed if the device could be cycled safely and comfortably by the patient. Descriptive statistics were used to evaluate demographic and patient-related treatment characteristics. 12 patients were included in the study cohort with a median follow-up of 12 months and a range of 3 to 18 months. The median age was 74 years and Charleston score was 5. The indications for AUS were stress urinary incontinence following robotic-assisted radical prostatectomy alone in N equals 6, 50% of cases, followed by RALP after external beam radiotherapy in N equals 5, 42% of cases, and there was one case after a whole EP. As seen in this chart, the median time from AUS implantation surgery to device activation was 15 days with a range of 13 to 28 days in 12 consecutive patients. The progressive reduction in time to activation in successive cases demonstrates our growing confidence in early activation by the clinicians. We currently routinely aim for activation of the AMS 800 at 2 weeks post-operatively. All 12 patients were able to tolerate early AUS activation and use successfully before 30 days, with a median interval of 15 days, range of 13 to 28 days. There were no adverse events of early activation at the 6-week mark. No patients required deactivation or re-evaluation in the office or clinic following early activation. All patients were satisfied with early AUS use and had no difficulty using the device. One patient had to have revision surgery due to a cuff leak 5 months post-operatively, and one patient developed a spontaneous urethral erosion 20 months post-operatively following a urinary tract infection. The median pre-operative continence pad numbers were 4, a range of 2 to 6, and these improved to a median of 0 and range of 0 to 1 and 6 weeks post-operatively. The median pad weight per day was 650 grams with a range of 190 to 1100 grams pre-operatively, and post-operatively a median of 5.5 and a range of 5 to 8 grams. To the best of our knowledge, this is the first study showing early activation of the AMS 800 AUS device in consecutive patients is safe and feasible. There were no adverse events due to early activation. Our preliminary experience indicates that early activation is safe and acceptable for patients, given all consecutive patients in the current study underwent uneventful early AMS 800 device activation. Furthermore, early activation enables patients to enjoy the benefits of the device earlier. We advise that further research with a larger cohort is needed to build on the safety of early activation and to ensure patient acceptance and safety is maintained with early activation of AMS 800. Thank you.